Good evening, everyone. A major change today for the Metro Police Department. For the first time, officers are officially out patrolling with mental health professionals at their side.
The newly launched program is called Partners in Care. And News 4's Carley Gordon joins us now to explain how it all works.
It all started right here in this room, and the idea is to divert the mentally ill out of the criminal justice system and to instead get them the care they need.
31 Pachetti, 33 and Hall.
It was a roll call like none other because these officers are leaving the North Precinct armed with a brand new tool.
I feel it's what we need, it's what our city needs, and it's what the two agencies involved need.
Mental health professionals like the ones you see here will now be working alongside Metro Police officers. Dispatchers will decide which calls warrant the new teams. Those teams will then decide if the person really needs to go to jail for an alleged crime or if they'd be better off somewhere else.
We'd like to see those people get treatment, because sending people to jail for those types of offenses when it's based upon their mental illness isn't serving that person any good, it's not really serving the community any good.
Police aren't the only emergency responders who stand to benefit. Paramedics with the Nashville Fire Department are also hoping this will result in fewer repeat calls.
Probably a good 30 or 40%, I would say, of the calls that we respond to, where somebody's having some kind of psychiatric issue or mental health issue, maybe a substance abuse problem.
The idea is to help people like Larry Brown. He's been arrested more than 200 times in Nashville. He's been in and out of emergency rooms and jails his entire adult life. Those who know him say it's clear what's been happening hasn't been working, and they want to change that.
So that's what we're looking for. Less repeat customers, which means they're connected to services, staying on medication, getting the care they need. Less people going to jail. Hopefully less people going to the emergency room because they're not in crisis either.
Once one of these teams comes in contact with someone out in the community, they'll be able to check back in to see how that person is doing. The program is starting small, just 16 officers spread across 2 precincts, but the plan is to expand it. Carley Gordon, News 4 Nashville.